Mr. Speaker, as part of our Teacher Dabre initiative, the construction of teacher accommodation units to improve welfare and attract teachers to rural areas will commence this year. Mr. Speaker, no new school will be built in this country without teachers' accommodation. Mr. Speaker, honorable members, once again for emphasis and for the record, I, John Dramani Mahama, President of the Republic of Ghana, will not cancel the free SHS program. I will not cancel the free SHS program. I am determined to make it better by improving its implementation. And also, for the record, students who have benefited from the free SHS since its inception are about 3.4 million. The figure of 5.1 million beneficiaries, as put out by the previous administration, was an exaggerated and false narrative calculated to achieve political credit. Mr. Speaker, while the free SHS program has improved access, the implementation of the program leaves much to be desired. The outcomes of the ongoing National Education Forum will guide our reform efforts in this sector. Mr. Speaker, in line with our promise, the Minister for Education has announced the restoration of Parent-Teacher Associations, PTAs, in the running of schools. It is important for parents and communities to participate in the administration of their schools. The Ministry of Education and GAS will, however, ensure that PTAs do not impose unbearable financial burden on parents and students who cannot afford them. Mr. Speaker, the double track system remains a challenge, and we are committed to eliminating it by accelerating school infrastructure expansion and completing stalled educational projects. To fund this, the Education and Finance Ministries are working to uncap the GET fund so that we can accelerate projects in secondary schools. As promised, we have begun improving secondary school feeding, and the children are getting better quality food as I address you. Mr. Speaker, efforts to decentralize school feeding and food management include strengthening procurement and store management records capacity. Once completed, food procurement and management will be fully handed over to the secondary schools to do their own food procurement. Mr. Speaker, science, technology, engineering, and mathematics are central to national development, STEM. We'll therefore expand STEM programs at all levels to equip all students for the global economy. We don't believe in building single standalone STEM schools. We believe that STEM must be part of the curriculum of every secondary school. Mr. Speaker, regional TVET centers of excellence will be established to provide practical skills. Every region will get a TVET center of excellence to expand technical and vocational education training. Mr. Speaker, honorable members, Ghana has consistently missed its gross tertiary enrollment targets, with a rate below 22%, far from the 40% goal that has been set by 2030. Despite over 460,000 secondary graduates coming out annually, 55% qualify for tertiary education, and only 35%, 161,000 of the 460,000 enroll in tertiary education, leaving over 300,000 without access. To address this, government is introducing a no-fee stress policy to eliminate tertiary admission fees, which currently serve as a barrier to higher education for some students. This will be supported by an enhanced student loan scheme, which is called the Student Loan Plus. The no-fee policy will also cover all persons with disabilities. And for emphasis, persons with disabilities will pay no fees for tertiary education throughout their study. And so PWDs who gain admission to tertiary institutions will pay no fees. Additionally, TVET enrollment will be increased from 11% to 20% to boost employment. Mr. Speaker, rising enrollment has strained university infrastructure, causing overcrowding and inadequate accommodation. We are determined to expand access, improve quality, and align tertiary education with national goals, particularly in STEM. Feasibility studies for new public universities or campuses of existing universities to be established in the 6 new regions will commence this year. Seed funding for these projects will come from the GET Fund in order to enhance access. Government will this year engage with the existing public universities to identify suitable sites on their campuses, acquired lands, for the implementation of the private sector participation in the provision of hostels project. This is a partnership between government, the universities, and private investors to expand hostel capacity on their campuses. This will allow more students to be accommodated on the campuses to allow for a better learning environment. Mr. Speaker, academic freedom will be upheld. We will not interfere in the administration of our tertiary universities. And our hope is that the institutions will ensure good governance in their administrative practices. Mr. Speaker, next, our health sector faces significant challenges that jeopardize the very foundation of affordable health care. The Ministry of Health has a total liability of nearly 15 billion cedis, when co-financing obligations, judgment debts, and payments to clear medical commodities at the ports are all put together. The last major hospital equipment replacement program was undertaken in 2014 when I was president. Since then, most hospital equipment in the Ghana Health Service facilities have deteriorated or broken down. Mr. Speaker, the Agenda 111 program, which was started as a knee-jerk reaction during the COVID-19 pandemic, when the Ghanaian public had begun to appreciate the significant investments that the previous NDC administration had made in healthcare facilities, and began to lament the many hospital projects that had stalled under the previous administration, a promise was made to build 111 hospitals. Mr. Speaker, I'm sad to note that there is no dedicated funding source for such a gargantuan project. There is no dedicated funding source for this gargantuan project. Mr. Speaker, for the record, as I speak, not a single Agenda 111 hospital is operational. In any part of Ghana, I challenge you, not one is operational. Mr. Speaker, and it is worth disclosing that $400 million has already been disbursed under the Agenda 111 project. Mr. Speaker, at a rate of approximately $80 million per hospital, this $400 million spent could have completed and made operational at least 22 of those hospitals. Mr. Speaker, I believe that the money should have been focused on completing a number of hospitals and making them operational instead of spreading it over the current 111 hospitals. As I speak, some are at the foundation level. and not a single one is operational.